like every year, CMS has released their proposed rule.
It's not an
And
AEP unless you see that happen in the middle of the season, right?
so historically for the past couple of years, they've waited until after AEP and even up until like the day before Christmas to release their proposed rule. But we got it right here, right before Thanksgiving.
Way to make
So
a already crazy year a little bit crazier, give us a little bit more something to digest in the middle of the game, right?
yeah, here, have an insane AEP and then take a look at our 465-page PDF and see if you notice anything weird.
I seem to remember the last couple years it being a little bit longer. I feel like we got a break with it being only 430 pages this year instead of, 900 plus.
Oh, I remember one year it was like over 1,000. It was crazy. It gets pretty crazy. But so it came out and we've had a little over a week and a half, well, about a week and a half to look at everything. What are your initial thoughts about the proposed rule for this year?
So I love the analogy that I've heard some agents use, like it's an early Christmas present, which I think there's a lot of really positive things in here. And I
Hmm.
think it kind of sends a clear message to us in the independent broker channel how CMS views our role and how that view has kind of changed over time. But I don't know if early Christmas present is the best way to put it because when you get a Christmas present, you can open it, you play with it, you take it out of the box. Here
Hmm.
we've got a Christmas present that we can't really do anything with until next fall at the earliest, where any of this
Yeah,
stuff can take effect. So it's great, but we have to keep in mind that this is the 2027 final rule. This is all tentative stuff, good
hmm,
things, but good things that won't really impact us until a year from now.
exactly. Yeah, everything in here is proposed. It's all maybe, or hey, what do you think, or this might be it, or do you think we're onto something here? And of course, we're in the comment period, which goes until January 26th. My initial reaction to this final rule coming out at late Friday afternoon, right before the weekend, is I I'm hopeful, and the reason I say that, and we talked about this before. The reason I say that is because for the first time that I've seen in quite a while, this final rule focuses a lot on how do we make changes to the program to make it for the better, but not just make it better for the end user, which is the beneficiaries, but really all the other stakeholders in the Medicare program. So a lot of the language that they use in the executive summary when they're just kind of briefing over a couple of the things is they talk about deregulation and they want to limit the administrative burden of certain things. And I haven't seen that language in a final rule in a while. There was years where the proposed rule, excuse me, proposed, this is all proposed. There were years with the proposed rule where it was like, you get into it and it's just hot and heavy. It's like, we're going to do this, we're going to do this, we're going to do this, we're going to do this. And it was all because, to protect the beneficiary, to protect the Medicare program, blah, blah, blah. And then this year it's like, oh yeah, but we want to do this, but we want to limit the regulations. We want to limit the administrative burdens. We want to limit the cost of implementing these changes. And there's a lot of that kind of language in here, which is encouraging because if we can get that for a couple of years, that kind of mindset with CMS is, hey, like, how do we pull things back a little bit while still keeping things in check? I think we're going to have some pretty lucrative final rules and proposed rules coming out over the next couple of years that are going to make some big impacts.
I think it's a really good point. I know we didn't really have a lot to dig into with the 2026 final rule. There were a handful of things, but I know with 2025 and 2024, myself, my team over here in the East region for JSA, I remember having multiple conversations with agents, kind of talking people off the ledge, saying, all right, there are some things that are going to impact us. There's going to be some changes to how we do business. But at the
Hmm.
same time, this isn't destructive to the industry. It's just, reel it in. And this is a completely different situation. The conversations that I've already had with some agents, and I think the first call I had, I initially saw the final rule post at maybe like 5 o'clock. By 5:30, I
Hmm.
already had somebody call me. Oh my gosh, they're thinking about getting rid of the 48-hour scope, and we'll get into that later. But I mean, there's been a positive reaction from the independent brokers that I talk to, and there's a lot more optimism about the industry as a whole and our place in the industry.
Hmm.
So it's been really pleasant to see that kind of just kind of change in mindset or change in our future outlook.
Yeah, there's also the one of the last things. So Henry and I, we've got a list of stuff we're going to talk about when it comes to the proposed rule. But the last thing we're going to talk about is probably the one that's going to take up the most amount of time, and that is hopefully, possibly, some positive changes to the old TPMO definition. So that's encouraging to see too, because I know, like, we as the industry, our lobbying efforts through NABIP and our partners and affiliates, a lot of that has been focused on, what truly is a third-party marketing organization, and what are we trying to do here. And we'll see some changes with that. So do you want to go through some of the changes so we can kind of work down our list
Yeah,
and
I
talk
feel
about
bad. I
this?
already spoiled one of them. We'll come back to that, but let's get
That's
into
it. That's
the
not even the
early
best
one.
one.
I
That's
know.
not even the
It's a
best
great
one.
one. It's a great one,
It's
and
a great
shame
one.
on me. So it's spoilers for anybody who's, forget I said that. But yeah,
Yeah.
let's get into the meat and the potatoes of this thing.
Yeah, so the first is, so I kind of take it in order as I go through the documents. I write down things that I think are going to be interesting, and that's kind of how we'll do this. So if you want to go download the full 465-page PDF, it's on the Federal Register. We'll have a blog post up where it'll link directly to it if you want to look at it. But as you go through it, when you get past the executive summary, because that just kind of gives you the press about the proposed or the proposed rule and what they want to do, and it's supposed to make you feel good with changes and things like that. The meat and potatoes is after that. So when you go through the executive summary, one of the first things I notice is a couple proposed changes to the Part D program. So the first one is we all know that the Inflation Reduction Act got rid of the coverage gap, and it got rid of the catastrophic phase, essentially by limiting the coinsurance down to zero. So we have today, 2025 today, and as we get into 2026, we have really a three-phase Part D program. We've got the deductible, we've got the initial coverage, which is up to that out-of-pocket threshold, and then we have catastrophic coverage, which is full coverage. So one of the first things they're doing is actually codifying that. So the Inflation Reduction Act put in the out-of-pocket threshold and the zero cost sharing after that, but it never changed the actual standard benefit of Part D. So this proposed rule was going to do that. So we're going to codify it to be, hey, now it's only three phases. We got deduction, initial coverage, catastrophic, and then we'll move on from there. So that one's pretty simple to understand as far as why they want to do that.
So, Chris, for the agents out there that are watching this, that are asking the question, does this affect me or how does this affect me? It really isn't going to change the way plans are designed or the play plans are built. It just codifies CMS's guidelines to match the IRA, correct?
Yeah, and one of the reasons I wanted to call it out is when it comes to, I've been following rulemaking at Medicare, like you. I've been following rulemaking at Medicare for a while, and you'll see pieces of legislation get passed, like the Medicare Modernization Act, which got us the expansion of Medicare Advantage in Part D. Then you had MIPA, which got us all the compliant rules and the scope of appointment forms. Then you had the Affordable Care Act, which got rid of the donut hole. Like, all of those pieces of legislation will make changes to the Medicare program, but that doesn't mean the base Medicare program actually changes. So the final rule is one of the few opportunities where CMS can actually make changes to the Medicare Advantage and Part D program. So all these things that are happening, and they may redesign benefits and redesign reimbursements. And yeah, this plan has a $2,100 out-of-pocket maximum, but the actual way that the law is written and the benefits are written really doesn't change that much. So with the final rule, this is their ability to make those changes. So we always look at the final rule like, how is this going to impact the independent agent and agencies and FMO's lives? But you really got to understand this is the opportunity for them to make big sweeping changes to the core benefits and how the actual Medicare program works itself. So that's why I bring those up, because it's like, we're seeing the Inflation Reduction Act, which was passed 3 years ago. Now we're seeing how it's going to be codified and how it actually changes the core Medicare program as we get into, in this case, in 2027. So that was the first one. The next one, and I got a lot of questions about this prior to 2025. So with the change from the Inflation Reduction Act and putting that $2,000 limit or $2,100 limit that we'll be dealing with next year, how does that impact creditable coverage? So with the proposed rule for 2027, they're going to be changing what they call the simplified determination methodology to determine whether or not a group or a union plan is considered credible coverage. So for this year, for 2025, you can choose to use either the simplified method, which you can go in and say, hey, my plan covers at least 60% of the cost for medications, or you can use the new method, which is 72% of the cost. When we get in, that carries on to 2026. When we get into 2027, they're only going to be basing a plan's creditable coverage status, an employer union group plan's creditable coverage status, if it has a 73% actuarial value. So that means when they take a look at all of the costs of the medications that are covered for any of the employees on the group plan, did the plan provide at least 73% coverage of the cost of the members' medications? This is going to have big implications because that old method that they've just been kind of kicking down the road and they're doing it for next year too, that's going to be gone. So all of these plans are going to have two options, all the group plans and retiree plans. They're either going to have to do a full actuarial study and submit that to CMS and say, yep, our plan meets your requirements. We are considered credible coverage. Or there's a simplified method where the plan can say, yes, we attest that this plan covers 73% of the cost of medications for our members. But that still leaves room for CMS to audit that in the future. For years and years and years, all the group plans do just the simplified attestation. I attest that this plan is considered credible coverage, but I think with the changes that are brought on by the IRA and the fact that they're getting rid of that old lower percentage threshold, I think you're going to see a lot of groups either go through the full actuarial study as compared to doing the simplified method. And what do you think that's going to lead to?
Well, and I know we talked about this a little bit earlier. What happens if that's not cost feasible for a group plan, or also what if it's not feasible for them to go through the work to have that full actuarial study done? So I think the question is, to your point, how does this impact agents and how does this impact retirees that are staying on group plans? My gut tells me that it's going to be harder to continue to be on retiree group coverage and have it be something that's credible.
Yep. Yeah, I think we're going to see some groups that traditionally offer things like HRAs, HSAs, high deductible health plans, things like that. I think we're going to see them no longer be considered creditable towards Medicare Part D. And when those notices go out in the beginning of the year or the end of the year for the following year, so as we get to the end of 26 and 27, I think we're going to see individuals that are still working covered by an employer or union group plan all of a sudden get a notice from that plan, hey, we're not considered credible towards Medicare Part D. You should really get some coverage. So I think there's going to be there'll be a big focus on people that are in that situation. We don't know how many. We don't know how many this is going to impact, but there will be some. It's going to be a situation where you're going to have to sit down with a client and you're really going to have to do your apples to oranges comparison. You're going to have to look at, well, here's your current group coverage. Here's what's available to you. The plan design, however that falls out. Here's what happens if you decide to leave that and get on Medicare, because I don't think it's going to be a situation where you're going to have people rushing to just get a standalone Part D plan. I think they're going to be looking to make the big change. Do I stay on the group plan or do I make the jump and do I go on Medicare? And of course, you're going to have the conversation, especially if you have like a non-Medicare eligible spouse. You're going to have that conversation. What are we going to do with them? I think it's going to lead to an increase in a lot of those conversations as we get into next annual enrollment period. It'll be a big opportunity for agents to help out. But that one little change, once again, codifying those little changes behind the scenes of Medicare, it's going to have big impact on the market.
I think we already saw a lot of folks make that move initially when on the drug component, there was now a max out of pocket on the Part D portion. I think there's still a lot of folks out there that may be paying out of pocket for their employer coverage that don't have coverage on the drug side that matches up. And it's very realistic for me to think that a lot of them just haven't made a change because they didn't see a need to. They didn't want to think about it. It's one of a billion different things on their mind. But
Mm-hmm.
once they start getting a letter from their employer saying, hey, our plan is no longer credible, now they start putting a little more thought to it. So I think over the next year, there's, like you said, a tremendous opportunity for agents that are building relationships with employer groups and HR departments, getting ahead of this. Not that anybody wants to create a ton of work for themselves next AEP, but hey, make hay while the sun shines. If it's a potential upcoming opportunity, might as well take the time to build those relationships over the next year.
Well, and I think that the incentives to stay on a group plan are slowly going away. And one of the ways that it's slowly going away is obviously you look at Part D. Part D's got a stop loss of 2,100 for 26. Who knows what it's going to be in 27? But you also look at what they're doing for those list of negotiated drugs. So we've got our first group of negotiated drugs coming out in 2026. We'll have the next group of 15, which they just released the list yesterday, coming out in 2027. And as those higher costs, a lot of them are specialty or biologic medications, as those higher cost medications now become more affordable because they're negotiated on Medicare. Some of our agents sat down with clients for the past couple of years, and one or two medications was the difference between whether or not they were going to stay on that group plan or go to a Medicare plan. And as those barriers get pulled away, Medicare becomes much more attractive. And now if you have plans that are just outright saying, hey, we're not going to be considered credible because we don't meet the actuarial value, there'll be a big shift. There'll be a big shift from the commercial sector over to Medicare.
I agree, knowing that if they, as a member, enrolling in a group plan, knowing that your coverage is now no longer credible and that you could be penalized in the future if you do change down the road, I think that motivates people to say, you know what, maybe I should get ahead of this.
Yeah, absolutely. Absolutely. So those are the changes to Part D. Another interesting change. I bring this up because it's an interesting one. So we've all heard over the past couple of years, CMS has been pushing towards the special needs plans to be able to offer benefits over and above like the regular ancillaries we see, like dental, vision, hearing, transportation, things like that. And SSBCI has become something that I say more often than I care to want to. It stands for Special Supplemental Benefits for the Chronically Ill. So these are for individuals. If you have certain chronic conditions, you can get access to certain additional treatments that aren't usually included or covered by Medicare or on a Medicare Advantage plan. So if you need housing assistance, if you need rent assistance, if you need home modifications, if you need, oh goodness, what do they use this for? Heating costs, there's all kinds of things that they use this for. They specifically state in the proposed rule that they're going to make a change to the prohibition on cannabis products for use with SSBCI benefits. And they've previously, we all know cannabis is illegal. It's illegal based on federal law. Well, because of the Farm Bill that was passed in 2018, there are certain hemp-derived legal hemp products that are on the market, and a lot of people are using them. I mean, we were just talking, there's one medication that even has just THC that's been FDA approved that exists on the market for anti-seizure. So because that hemp bill specifically the Farm Bill specifically carves out those hemp-based THC products, CMS is saying, well, maybe we should codify the SSBCI benefits to possibly include some of those. So that's kind of an interesting one.
It's interesting they carved that out, and they also specifically said that actual cannabis products are 100% not allowable, again, because marijuana is illegal under federal law. And it's
Yep.
interesting. I never would have second guessed that. I just figured that was fairly the norm, but I have had a couple of questions on that. And there are, I guess, potentially situations where that makes sense. Unfortunately, fortunately, however you want to play the game, at
Mm-hmm.
the federal level, cannabis products are illegal. So it's not something at this point in time that is going to be covered in any formal way by Medicare.
Yeah, and even if one of these special needs plans is like, or even a regular plan can have SSBCS technically, but even if one of them says like, hey, we want to start covering this, they're going to really have to convince Medicare that this is necessary. Otherwise, I don't think Medicare is going to do anything. But it's interesting that's included in the proposed rule this year. Usually, the rules you see in any of the proposals that CMS comes out with, there's always some kind of driver behind them. So whether it be, congressional pressure, whether it be the regional CMS office pressure, whether it be lobbyist pressure from the various different groups, including AHIP, AMA, all those things. I wonder where the pressure on that one came from.
That is a very good question. I think we could go down a conspiracy theory rabbit hole about who's invested in weed farms commercially.
Who's asking CMS to legalize cannabis? All right. So that was a fun one. I tossed that one in there. So the next one, as you go down through the document, and this one I think is going to be a huge benefit to a lot of clients. I just read an article this morning about this exact issue and how it's kind of ballooned since 2022. But we've all dealt with, it doesn't matter what part of the country you're in, everybody saw this or heard about this, are the Medicare Advantage and provider contract battles. They're popping up everywhere, everywhere. I mean, you had some in the East region this year too, right?
Some is an understatement. I had some that came up this morning. And I've got some of them that I don't even know if are public yet going on here in Florida. We've got Bon Secours and VCU in Richmond, Virginia. I know Buffalo, New York, one of the major cancer centers went out of network with a good number of the carriers, and it's just been pretty significant in terms of people having to move around. And
Hmm.
one of the things that I say I would kind of point out is, to me, over the last 12 to 18 months, these provider exits or these provider negotiations have become a lot more adversarial in my observation than they had been prior to that. I've even had me getting calls from representatives from some of these hospital systems saying, hey, this carrier is going to no longer be in network with us. You need to tell your agents to move all their clients. Excuse me?
Yeah, right.
That never happened. And some of these were just by virtue of how a lot of the negotiations happen behind the scenes until it becomes apparent that it's not going to work out. We as JSA, as members of the kind of the broker channel, find out at the same time brokers, and find out at the same time even clients find out, and that's when the provider groups are now taking those negotiations and becoming a lot more public with them than they have been in the past.
And you could usually tell by the language in those negotiation how it's going to turn out. Like we had a situation down in Milwaukee between United Healthcare and Ascension. And it was like, as of October 1st, our contract's over. But every time, so Ascension would come out with a press release, United Healthcare would come out with a press release. Every time you read those press releases, it always ended with, the contract's going to be terminated as of October 1st. We hope to reach an agreement. We hope to continue. We're continuing the negotiation. We hope. So there was always like this little carrot in there. It's like, hey, we're still talking. We're still trying to figure this out, but our contract is terminating on October 1st. Whereas you look at other battles, like there was a battle with United Healthcare and Providence Medical in Southern California, and all of the press that was released on that was, yeah, we're done. There was no like, we hope to reach an agreement. It was like, nope, we're just
Like, both sides have walked
our
away from
agreement's terminated.
negotiations. We've packed up our toys. We're going
Yeah,
home.
yeah, we're done. We're not doing this anymore. And I read an article this morning. It was put out by a research company called IFT, and they were talking about just the frequency of these kind of negotiations that are happening, and it all results to the whole post-COVID deal. So the reason that like medical inflation, everything is through the roof on the Medicare side, it's the same reason. So those hospitals, nobody knew that COVID was going to happen in 2020, but those hospital networks had 3, 4, 5-year agreements in place at that time where rates are locked, reimbursements are locked, carriers are paying what carriers agreed to pay, and hospitals are getting paid what they agreed to get paid. And now it's come time to look at the medical inflation and the rising cost of everything and have those conversations. And some of the hospital networks are looking at it going, listen, like, if we can't get a more favorable rate from you, like, instead of like, let's continue this conversation till we can work it out, it's like, listen, if you and I can't come to an agreement that even helps to shore us up in any way, shape, or form, we're done. We're just going to move on. And more of those conversations are happening than ever because of COVID. So a lot of the things that we're dealing with on the Medicare side, a lot of things we're dealing with on the med sup side with the crazy rate increases, it all goes back to COVID. COVID's still rearing its ugly head. But the proposed rule that is coming out, which I fully support, we here at JSA fully support, is there was a special election period. There is a special election period that if you have a significant change in provider network on a Medicare Advantage plan, there's a special election period that exists, but the client has to call 1-800-Medicare, plead their case, and Medicare is the one that could give them the opportunity to change. What they want to do with the proposed rule is to actually no longer make it a significant. So literally it's SEP-significant change in provider network. That's this SEP code. They want to change it to SEP-provider termination. And they're going to change the qualification of who qualifies for this. So the proposed qualification requirements for this new special election period is any enrollee who is assigned to, currently receiving care from, or has received care within the past 3 months from a provider or facility that's being terminated. Furthermore, if you look a little bit down the document, they're going to be requiring the health plans. So if a provider is being terminated from the network, they have to notify anybody who has been seeing that provider based on the claims data they have that, hey, this provider is no longer going to be a network. Here's information about the special election period that you now qualify for. So they're going to make the special election period way easier to qualify for because now you don't have to wait for CMS or the plan to determine what a significant change in network is. And they're going to be notified directly, hey, Dr. Smith is going to be leaving the network as of November 1st. Here's your special election period. So it's going to be out in the open. It's going to be out there for everyone to use. I'm pretty excited for that one because there's just always a ton of, and these contract negotiations don't always happen during AEP. They could happen in January, February, March, any month at all throughout the year. So this would be a huge benefit for us if this goes through.
And what I think is really cool, yes, it's a benefit to us, but I think it's a bigger benefit to the beneficiaries. I think the story I'd tell is I mentioned VCU in Richmond. VCU is one of the premier cancer centers for cancer treatment up there. And one of the carriers, I don't want to throw anybody out there, but one of the carriers lost them partway through summer. You had folks that are actively getting treatment there going, what do I do? My plan's no longer like covering my cancer treatment at this hospital. Do you change hospitals in the middle of your course of treatment, or now you don't even have to worry about that? You've got an SEP, you can address that. There's continuation of care, and I think at the end of the day, that's the most important thing. So, yes, I agree 100%. It's good for us as agents because we can continue to help our members, but the benefit to the end member is what I'm excited about.
I want to also call out on this one. So in the section of the proposed rule, if you download the PDF, it's on what page are we on here? Hold on, I can't see, 162 of the PDF. So in the notice that they have to now, that they're going to be, if this goes through, that they're going to have to send out with this, they're going to have to talk about, you have to talk about the AEP and MAOEP. You have to talk about the special election period, including the start and end dates. And then here's a bullet point in here, which doesn't make sense to me, but makes me hopeful that we might see some changes on this. Medigap guarantee issue rights. So currently, there's no guarantee issue right if your provider leaves a Medicare Advantage network. But the proposed rule from CMS says in the notice, you have to notify people what their guarantee issue rights would be for a Medigap policy. Interesting.
That is interesting.
Mm-hmm.
I would love to have a conversation with some of our folks in the Medicare supplement community, because the question I have then is, how does that impact pricing, loss ratios? That would be interesting, not necessarily from expecting a good or bad outcome, just as a student of the industry. How does that impact the quality of risk that starts moving around between plans?
Yeah, we really haven't seen any changes to the list of guarantee issue rights since, the Medicare Advantage trial right came out when MIPA was passed. So there really hasn't been really any changes to guarantee issues. So to include that, like if you're on a Medicare Advantage
Never
plan and
ending
you're,
stream of state-based guarantee and guaranteed issue provisions.
that would
I'm
be
gonna
that
I'm
would
gonna
be
derail
wild.
this conversation by getting Chris on a soapbox.
I put the soapbox away today. Lizzie told me we can't record this for too long. So let's see here. The next one we're going to talk about is a rule that was put into place this year. So there was a brand new rule put into place for 2025. Was it in place for 2025? Yeah, in place in 2025. Will be in place in 2026. Hopefully will be gone in 2027. And that is the 12-hour waiting period between having an educational event and a sales event at the same location. So they're looking to get rid of that. Go bye-bye.
I think that's going to be one of the ones. It may not be the one that excites people the most, but this should be up there. A lot of the agents that I work with, they're still doing educational events. They're doing in-person meetings, especially now this time of year. No one, unless they're working with a specific carrier and having the carrier help them with the costs for an event. A lot of the agents I talk to say, you know what, I don't want to go in and just pitch one specific carrier. Part of the benefit of being an independent broker is the fact that you can work with multiple carriers. No one carrier is going to have the exact plan that everybody needs. So a lot of the agents we work with tend to lean towards educational events, but at the same time, having to basically say, you know what, these are the changes, these are the things that are happening this year. Catch me in, a day or 2 days or however long. Then we can talk about potentially getting together to solve your issue or help update your plan. Getting rid of that 12-hour waiting period, I think, gives us as agents the ability to better serve clients, because let's face it, our time is extraordinarily limited during AEP. And what's going on right now, we had it last week and we're going to be kind of in it for the rest of this month. We're in the holiday seasons. Our
Yep.
members are traveling. They got families. their time isn't infinite either. So telling them they have to wait a day, 2 days, or more just to get with us when time's limited, this gets us the ability to better serve and better help those members.
Absolutely. Yeah, the regulation too is you can't have a educational event and a sales event within 12 hours each other at the same location. And then they even define what a location is with that rule. So this would just get rid of that rule altogether. But you piggyback that on some of the other changes that are happening, and it becomes clear that doing events in 2027, if these proposed rules go through, is going to be the way to go. Because the very next thing that we could talk about is the fact that they're going to be allowing agents to collect SOAs at educational events.
Exactly.
Yeah, so so you do an educational event, you do an SOA, you're not booking an appointment, you're not talking about any plans, benefits, premiums, none of that stuff, but you're able to collect that scope of appointment form. And the regulation, the way they have it written in there, is they're saying getting a signed scope of appointment form is not a marketing activity because you haven't talked about plan benefits, you haven't talked about the client situation, their medications, their drugs, things like that. So you haven't really done anything from a sales or marketing perspective. So why not let people collect scope of appointment forms? All it is just an agreement. Hey, you have this kind of scope of appointment form. We're going to have a conversation about this at some time in the future. So I am all for allowing agents to collect SOAs at educational events. We used to be able to collect SOAs at educational events. So that one went away for a little while. This last final or the final rule for 2026 allows us to pass out SOAs at educational events, but we can't collect that, but we can make them available in 2026. In 2027, we'll be able to not only make them available, but actually collect them at educational events. So that's pretty cool.
I think that kind of segues into some of the changes specifically regarding scope of appointments. And one of the ones I was kind of excited about, even bypass the one I mentioned earlier. We'll get to that one. That's kind of to me, the big cheese here. But the way they look at scope of appointments, like the definition of a scope of appointment, things in the past that haven't technically been considered scopes now being able to serve as scopes, that being business reply cards, voicemails, web forms. As long as they specify the product you're going to talk about at the meeting, they now serve as a scope of appointment. So I thought that was really cool.
Yeah, so it's that one confused me when I first read it. But when you think about it, so if you have like a business reply card and your business reply card is all about, hey, put down your information, I'm going to contact you about your Medicare Advantage, Medicare Part D, and Medicare supplement options. When you get that business reply card, you have to call the client. So you get your permission to contact. That's what it's primarily used for. You get your PTC. You call the client based on that reply card and you say, great, yeah, let's have a meeting. I'm going to send you another form to fill out. So that's what we have to do right now is I'm going to send you filled out this form. I'm going to send you another form to fill out. So it even says in the proposed regulations for that, it's a duplication of efforts. Like
$100%.
it's another form that is needed when you have permission. So business reply cards is awesome because a lot of our agents use those in mailers. We got a lot available in the pro shop. You'll be able to use those. Voicemails is the coolest one in my opinion. So if somebody calls you, so if I called you, hey Henry, I need to talk to you about a Medicare Advantage plan. That voicemail is your scope of appointment form.
I love
I
that.
called you. Yeah, I called you. I said, I want to talk about Medicare Advantage plans. You have your scope of appointment form. Now we can go ahead and have that personal marketing appointment. That to me is the coolest.
So I agree. I think that's cool. What I like about the business reply card a little bit better is I do think one of the things that's going to happen, and I can guarantee I don't even have to ask. I know you guys are going to update it for our business reply cards in the pro shop. Is it says you can only talk about the products that are mentioned on the business reply card. So I think you're going to see all the mail houses that you work with, all our lead vendor partners, when they structure their business reply cards, they're going to just automatically default to showing every box checked. And I think we're
So
going to see
yes, I think we're going to see a change of that. So right now there's the disclaimer requirements for BRCs. So the disclaimer requirements are specific to the Medicare products only. So you have to state specifically by submitting this information, a licensed sales agent will contact you in regards to a Medicare Advantage, Medicare prescription drug plans, or Medicare supplement plan options. So that's required on a business reply card that has to do with Medicare. What that'll change to is it'll be those three things, but also hospital indemnity, dental and final,
exactly,
dental and hearing and
exactly,
vision, supplemental
because
benefit
you want to be
policy.
able to talk about all those things.
Mhm.
A, because cross selling is important, but B, our clients don't have just one need, and we want to be able to address the full range of needs that an individual could potentially have. So the only way to do that is to make sure you're putting a disclaimer in there that talks about all the potential products that could be talked about in the course of that call. So I, I think that's great because every once in a while you do get someone, oh, I would have loved to talk about hospital indemnity. You didn't check the box on the scope or it wasn't checked. Well, this just bypasses that and makes it a little easier to do.
Yeah, and same thing for web forms. So web forms have to have that same disclaimer too. It's essentially the permission to contact disclaimer. Just add those additional products to it. So I'm hoping those proposals go through. I want to see SOAs back at educational events. I want to see us being able to use these other types of scope of appointment forms as scope of appointment forms. I especially want to see that 48-hour waiting period.
Absolutely.
So
Absolutely.
that was one of it specifically pointed out. We're going to get rid of that 48-hour waiting period. You just have to get it signed before you start talking about benefits and things like that.
I
So
think
going back to
when that
what it
happens, I
was.
think we're going to see the volume of walk-in appointments decrease tremendously because
Hmm.
we all know that that was one of the loopholes, and whether good, bad, or indifferent, it was used. Um, and I think along with that, one of the things that's actually kind of cool is there are a whole bunch of technical exclusions to the 48-hour rule. If you're at a registered sales event, you didn't have to get a 48-hour scope. If it was a inbound call or someone walked into your retail location, or the one that's most pertinent for us over the next couple days, if you're watching this in real time or shortly after we film it, we're in the kind of the tail end of AEP starting Thursday the 4th. Get a scope at the start of the appointment. You don't have to have a 48-hour scope for the last 4 days of an enrollment period.
Yep.
Come 2027, if this thing passes, we don't have to worry about, well, is it 4 days or 5 days? Get it at the start of the appointment.
Yep. Get it at the start
That's
of the
going to be,
appointment.
that's going to make everything, or not everything, but it's going to make a lot of the process a little bit easier to manage, especially if you've got a large book you're looking to service during AEP.
And it works better for scheduling purposes. Like we complain as agents, it's 48 hours. So I get a form signed. I have to wait 2 days in order for me to go see them and have the meat and potatoes conversation to get a plan. What if, all right, they were able to sign the scope of appointment form today. What if they're not available in 2 days? What if something's going to come up and now I can't reach out to them until the very last day of the month? And we really need to make sure this gets in. It's going to help with scheduling. It's going to help with it's just making the whole sales process much more palatable for the beneficiary, because it's not going to be, you have an expectation. Like I had to call my PNC agent today. I told him, Scott, I got rid of a car. I need you to drop for my insurance policy. They're like, perfect. Let's go ahead and do that. Imagine if I called Scott and said, hey, I need to drop something for my insurance, or I need to change my insurance cover. And he goes, sweet, I'm going to send you a form and then call me back in 2 days. I'd have been like, I don't think you're going to be my agent anymore, Scott. So it's frustrating from a consumer standpoint to go through something like that. So now we don't have to worry about that. So that's exciting. So some other easing the burden on agents. The next one we'll talk about is our best friend, the TPMO disclaimer.
Ooh, I love it. I love it.
Oh, I'm going to get there'll be
So
some fun comments on that one.
I want to tamper everybody's enthusiasm right now. That disclaimer is not going away 100%. So
No. Nope.
let's ease into this here. It's still going to be with us for a while, but there's some changes they're making to it that do make it, I think, a little bit more palatable and a little bit more just easy to implement in the course of your conversations with members on the phone.
And it's kind of funny too. And I'll explain why it's kind of funny. So tell them about the change.
I think you and I have different things that we may find funny. So the one I see here first is the one that I think you and I probably both agree is a little bit humorous. I wish this is almost a webinar because I'd love to get audience participation. But I'd tell folks, raise your hand if you've been frustrated about the fact that you have to mention SHIP in your TPMO disclaimer. I mean, I think every single agent I've talked to has had a situation, and I'm not saying all SHIP coordinators are bad, but has had a situation where something happened and a client was put in a plan that was not ideal for them. And I think that's a political way of saying not right. Um, and it was the result of working with a SHIP coordinator. And I think I might have even mentioned it to you, Chris. I think the verbiage in the actual PDF itself, I think, was probably one of the most well-written, politically correct pieces I've ever seen. And I'm paraphrasing here, but it basically said that we acknowledge that not all SHIP offices receive the same level of training, and even among individual offices, different representatives may have differing levels of training. So there is not a consistent experience that would be had by someone reaching out to them. So instead of referencing ship going forward in the TPMO disclaimer, according to the draft, starting in 2027, you would refer folks directly to 1-800 Medicare.
Can I read the verbiage? I pulled it
Please
up.
do. Please
All
do.
right.
I
So
feel
it's
like
on
this is gonna
page
be the
1.
part that gets snipped and mass produced on the
Yeah.
socials because this is just chef's kiss beautiful.
So it's page 192. So they're talking about changing the disclaimer. So it is CMS recognizes that while ships can be a source of unbiased information about plan choices, informing beneficiaries on every sales call about the ship may cause additional issues. Ship volunteers may not always have the expertise to help beneficiaries navigate increasingly complex MA and Part D programs. CMS believes that beneficiaries enrolled in the MA and Part D programs may be more effectively served by information and entities for which CMS has direct oversight,
Now, Chris,
aka ships are morons.
correct me if I'm wrong, but I believe there was a study that came out 3, 4, maybe 5 months ago, and it was something like only 40% of folks that reached out to a ship office actually received a call back. It was some obscenely low percentage, and just the take the training and knowledge portion out of the equation, just the user experience in some of these cases was not there. If you're making a decision on a time frame, and whether it's business practice or just the capacity that these offices had, they didn't have the capacity to really meet the needs of members.
Yeah, they don't have the expertise. They don't go through the same training we do. They don't really dig themselves and ingrain themselves into this industry like we do. Yeah, they talk about that study. So in here it says, in this study, mystery shoppers posed as individuals newly eligible for Medicare, while over 94% of the responses differentiating original Medicare from MA were accurate. Fewer than half of the counselors mentioned dual eligible special needs plans as an option for mystery shoppers posing as dually eligible beneficiaries.
Oof,
Yeah,
yeah.
rough. Yeah, so that'll be fun. So we get to remove that. We also get to change when we say the TPMO disclaimer. So one of the big
I have a
changes
theory about this. Talk about it, and then I'm going to tell you why I think this happened to come up.
one of the updates to the TPMO disclaimer is currently we have to say, so on a marketing or sales call, we have to say our TPMO disclaimer within the first 60 seconds of the call. So you have to say the whole thing. I offer this many plans and this many plans. I don't offer every benefit, call, ship, or Medicare. We have to say that within the first 60 seconds of Medicare or marketing and sales calls. The proposed rule would actually move the timing. So we still have to say it, but it would move the timing of that disclaimer from the first 60 seconds to before discussing any benefits whatsoever. So that would make it would be like a much more natural conversation. Instead of just picking up the phone, hi, Chris Hagerstrom. We don't offer every single plan in your area. You could actually have a conversation before you get into the benefits, kind of like removing the 48-hour scope window.
Agreed.
You don't need it until you actually get into benefits. So what's your theory about that?
So I agree. I
What's your
do think it
theory on
helps
the
the
proposal?
conversation flow a lot better, and it's a lot more user friendly. But I do find it coincidental for any of the inbound lead transfer vendors out there. Typically, you get a certain window of time to vet a call, and you can disconnect before that window ends. And if it's not a fit, if it's not a good lead, you can disconnect, and you won't get charged for that call. What is that window usually at? Roughly how many seconds? 60? So how easy is it to vet the call? Well, you have to spend 30 to 45 seconds going through this TPMO disclaimer. It really and I think it's beneficial for our agents to do utilize those services. You can get to the meat and potatoes, vet the call, and you can disconnect if it's not a valid lead or transfer, and not waste half the time you'd use vetting the call, spouting a canned disclaimer. That's
Yeah.
my thought.
Yeah, I agree. And also I know of a lot of agencies that are partners with us that updated their phone system to rattle off their TPMO disclaimer as part of their welcome message.
That's
Yeah,
smart.
so imagine like it is smart, but think of it from the beneficiary standpoint. You call an agency and you're hearing this, hi, thanks for calling Hagerstrom Insurance Agency. We offer 15 carriers with 176 different plans available. We don't offer every option, blah blah blah. You hear that every time you call. I don't like
That would
that.
get frustrating.
It's weird.
Helps to
We're
make
the
sure nobody
only
forgets to say the disclaimer, but as a member, that would probably make me want to pull my hair out.
we're the only industry where we have to directly suggest reaching out to other people as part of our process. Like you don't call Domino's. Like Domino's going to pick up the phone and be like, "Hey, thanks for calling Domino's. You know,
Good
you could also
point.
get pizza from Pizza Hut and Papa John's and all these other guys." Like we're the only industry where we have to literally say, "Hey, call Medicare or SHIP currently and call Medicare directly."
But you want a pizza? Call me back in 2 days and order a pizza.
Yeah, you want a pizza? Call me back in 2 days. Yeah, exactly. Oh wait, hold on. Are we within 4 days of Sunday? Okay, yeah, I can get you a pizza right now. Yeah, it's that's a great analogy. How are we like a pizza place? And then
Right.
to help
Yeah, the
ease
last one is the time frame that you have to store recording. Is it gonna change the way any of us do business? No, but I think it does make it a lot easier, because at the end of the day, data storage is expensive, and changing it from having to store your call recording from 10 years only to 6 years, it's a cost savings, and it's basically a gift to us.
so with that, so they want to move it from 10 years to 6 years for the data retention. They even left some wiggle room for interpretation there. So there's some you read a couple things, you read a couple analysis of this. There's some people that say, well, it could be even less. It could be less than 6 years. So interesting. I mean, like in all reality, because these plans are based on the year and the average lifespan of a client in a Medicare Advantage plan is a little over 3 years. Like, can we knock that down to like maybe 4 years for data retention? 5 years? It'd be nice to see some updates there, but at least they're making it 6 because yes, data storage is expensive, and they even cite in the I think it's in the executive summary part for that it could help save the industry, which is agents, agencies, and carriers, millions of dollars by just making that one data storage change. So that would be kind of neat to see. And then we have some rapid fire ones, and then we'll get into one of my favorite topics that was brought up in this. First, they want to change some of the star rating measures to essentially boost overall scores. So they're going to get rid of some of the star rating measures that ultimately don't determine whether or not you have a good plan. They determine whether or not you can follow the rules the best. So they're going to get rid of some of those measures and the star ratings to boost the overall scores, but it still keeps obtaining the illicit 5-star status pretty difficult. So the changes would be nice because it's a lot of the news articles you see about Medicare over the past couple of months, actually past couple of years, probably the past 2 years, it's about carriers battling CMS about star ratings. So star ratings come out in October, and then the very next week there's litigation filed against CMS because they're suing them for star ratings. So this would hopefully remove some of those litigation costs from the system while boosting scores and scores, the change and shift in scores year over year, that's what leads to a lot of service area reductions. That's what leads to a lot of non-commissionable plans. Is you've got a very popular like 4-star plan that gets all of the enrollment for years, and then CMS makes this weird change to the star rating requirements like they did from 24 to 25. And then all of a sudden it's a 3.5-star, and now that plan is no longer paying commissions and half of them are leaving the market. So
So,
star
Chris,
ratings
for any of
has a
our agents
huge
on here that
impact.
may not necessarily know why star ratings are important to a carrier, what's the big deal for star ratings? So I've got a 4-star plan that goes to 3.5 stars. What does that mean other than I look different when I get quoted out on Medicare.gov or on any of the enrollment tools?
So with star ratings, so if you have a over a 3.5-star rating or 3.5-star or higher, so essentially 4-star. If you have a 4-star rating, you get a big bonus from Medicare in your reimbursement rates. And that's on a per member per month basis for the entire book of business. And we have one carrier this year where their largest contract across the nation went from a 4-star to a 3.5-star. So it just lost a half-star, which is not that big of a move when you consider it's a 5-star system. It meant $80 billion in lost revenue because of that one half-star change.
So
So
when we
those
see
star
carriers
ratings mean a
talking
lot.
about how reimbursement rates from CMS are so important, we see that that's kind of driving a big portion of the conversation in the industry. Changing the star rating system to make it easier, not necessarily get a 5-star rating, but to get a higher star rating and to get some of that additional revenue. That's a big deal. And I know we've seen a lot of carriers this year. There's been some plan degradation,
Yeah.
giving carriers the opportunity, the ability to get more revenue without necessarily it just being a flat increase, but by being able to earn it through higher star ratings. That should ideally give them the chance to continue to offer some of these more lucrative benefits that we've seen in the past few years.
Even lucrative benefits, but even maybe provide some stability to a market that's pretty unstable right now.
That's true.
And, with all the service area reductions, with all the plans coming out as big non-commissionable, even like the mid AEP and like suppressed non-commissionable plans that we dealt with this year, like bring some stability back to that, because the reimbursements are the biggest driver on whether plans are on the market available to sell or if they're off the market and they're not selling. So making it easier for carriers to achieve beneficial, profitable star ratings, which is essentially 4 stars or higher. Because whenever you go to carrier roll, it's like 96% of our plans, our members are on 4-star or higher plans. Like that's the level they want to reach. So if we can help carriers get to that 4-star level, that's going to create a lot of stability in the marketplace. It's going to create predictable products that our clients can be on year after year, where we don't have the chaos that we've had over the past 2 AEPs, where we're just essentially cooking our books on both sides just to make sure our clients are covered by a plan. So that would be nice. So that was one of the other changes they were talking about. They're actually looking for feedback from carriers in the industry about some of those proposed changes. I'm not going to bore you with all the individual aspects of that, but I agree with most of the proposals there. The next one is fun, because I called this back in April of this year.
I feel like you and I had this conversation almost a year
Yeah.
ago, and then as we started seeing some of the new plan design this year, you and I
Yeah.
kind of both looked at each other like, "Hmm,
Yeah.
someone's gonna put eyes on this." And it's
Yeah.
good to
So
see. First of all, it's personally fulfilling to know that we were right, that we
yes.
kinda saw it coming, but it's also, to me, it's good to see that CMS is actually doing like we said they wouldn't, actually putting eyes to something that
Yeah.
kind of was a kind of big shift this year. So tell us about it, Chris.
So if one of the big changes that we had for 25 was the loss of the quarterly SEP for dual plans. We instead got a monthly SEP for integrated dual plans. So if you have a Medicare and Medicaid dual special needs plan, but it was also integrated, which means that it actually worked directly with the state's Medicaid program and had a contract with the state Medicaid program, they would have a monthly SEP to move people into this integrated dual plan. Unfortunately, not every carrier that offered a dual special needs plan also has that state Medicaid contract, which is a state by state contract. And even in some states, it could be county by county. So what happened is some carriers were releasing chronic special needs plans that looked a lot like a dual special needs plan and were enrolling people using the chronic SEP into a dual special needs plan. So essentially, instead of going through the process of getting that contract and having an integrated dual plan, they were sidestepping CMS's goal of making sure that those Medicare and Medicaid plans are truly integrated and truly coordinated, and enrolling duly eligible beneficiaries onto a chronic special needs plan, because that's the only way that they were going to be able to play in that space and be able to write a majority of that business outside of the annual enrollment period. What CMS is doing, so CMS hasn't come out and said we're going to do anything about this. But what CMS has done is they put a request for information. So there's an official RFI out there from CMS that is looking into, and there's all kinds of data and stuff that they include in that. There's actual charts in this year's rule, which is interesting because there's not usually a lot of artwork. But there is some charts looking at the percentage of dual eligible individuals enrolled into a chronic special needs plan. And they're requesting information like, why is this happening? And what is the justification behind putting them in a chronic special needs plan instead of an integrated special needs plan, which are available in their areas? So while CMS hasn't done anything about this, they're coming out and saying, we want to get more information and we want to dig our teeth into this a little bit more. My prediction, Henry, let's do more predictions on this, is we will see a shift in some of the guidance from some of the carriers who have been operating this way, away from this is where we want you to put your dual eligible members. I think we're going to see them kind of shy away from this because CMS is openly saying, we're knocking on your door and we want to know why you're doing this.
And I think part of the thing that caught CMS's eye and the reason this is coming out, and yes, this is the practice of having a C-SNP plan that's being marketed to or pushed towards your actual dual membership. That may be something fairly new in the last year, but that's not the growth in the C-SNP space isn't that new. We've seen that trend since 22, 23. The D-SNP market is more or less plateaued. New enrollments to D-SNP plans is actually starting to go down, but the C-SNP space is blowing up. And
Mhm.
anytime you see a segment of the market have tremendous growth, I want to say it's doubled every year for the last 2 or 3 years. I could be wrong on that, but I want to say that's about where the numbers lie.
Mhm.
Anytime you see that type of sustained significant growth, that's going to be something that catches regulators' eye. Either we have a tremendous amount of new CSNP plans coming on the market, and that's what's driving enrollment, or we've got a significant increase in folks that are newly diagnosed with chronic conditions, or it's more likely there's an opportunity there. Carriers are chasing it, and because it's growing, now there's an additional need to actually put eyes on it and make sure we are putting people on chronic plans that belong on chronic plans. And
I remember
I'm not gonna get on my C-SNP soapbox. I told myself I would.
we appreciate that. I remember, there were I can't remember, it was like 2016 or 2017, there were actually dual chronic special needs plans that were on the market. Friend, I can't remember if it was still from Bravo at that point or if they had transferred over to Health Springs officially, but there were plans that were chronic special needs plans that were specifically designed for dual eligible. So you not only did you have to have the chronic condition, but you also had to have a Medicaid level. And those came and gone in a flash. So it gave me a lot of vibes like back in those days when we were chasing this very specific population or being asked to chase this very specific population, which seemed definitely out of reach. But yeah, look out for that to change in the marketplace. If you have carriers that are pushing C-SNPs to dual plans, telling you specifically, we want your dual people, you could use the chronic enrollment period to get them on this plan. There's nothing wrong with that. CMS isn't saying there's anything wrong with that. We're not saying there's anything wrong with that, but CMS wants to know how come they're not in an integrated plan, because that's why they made all the changes to the election periods is to help those individuals. Furthermore, they're actually another part of this proposed rule is they're looking to expand passive enrollment of dual eligible individuals into those integrated DSMPs. So that happened. The demonstration, the MMPs, the demonstration programs that all kind of sunset at the end of this year. That's what happened to those individuals. So they were passively enrolled into the MMP program unless they actively chose another option. But with the sunset of those MMP programs, CMS is like, well, we could still provide some assistance to get those individuals on a plan that's not just Medicare and the state Medicaid program. So they're looking to increase the passive enrollment of some, not all, but of some dual eligible individuals into the highly integrated dual eligible, or those HIDE plans across the country. So I don't know what that's going to look like or where that's going to happen, but that's something that they're definitely looking into, which I'm not against, because even it's a passive enrollment, which means there's still an opportunity to opt out of that if necessary. And then what was the last one
I
before
think
we
we had
get into?
one more small, I don't wanna say small, but the mid-year supplemental benefit notice.
So
I
the
think the
one of the
administrative
things,
burden on the carriers, I think collectively they're all breathing a little bit of a sigh of relief for figuring out how they're actually gonna administer those mid-year notices, and I don't know if that necessarily drives CMS policy, but I know the carriers are all collectively breathing a bit of a sigh of relief, hoping that goes
yeah.
through.
So this change was supposed to go into effect this year in 2025. It was postponed. So so a little background. So the 2025 final rule said carriers have to send out a mid-year supplemental benefit notice. So at the end of June, beginning of July, anybody on a Medicare Advantage plan, you had to essentially send them a ledger that said, here's your dental benefits, here's what's still available, here's how you access it, here's your fitness benefit, here's what's available, here's your OTC benefit. They had to do that for every single client across the country. That guidance was pushed back by CMS to say, we're not going to institute that in 2025. We're going to do it in 2026. So in 2026, there is going to be a mid-year supplemental benefit notice. This proposed rule for 2027 would get rid of that. We are going to have a mid-year supplemental benefit notice unless it gets pushed back again. But as of right now, come end of June, end of July of 26, these mid-year notices are going out. This would, if passed, and I think they're going to, because every carrier came out and said this is impossible.
We can't
So
we don't have the manpower, we don't have the automation technology to
yeah,
actually just pull that type of data for everybody and send it out.
yeah, we can't administer this. This is bonkers. So that'll be, if this is approved, it'll be officially gone. So I was kind of interested to see what would happen with that, because whenever you increase utilization for an ancillary benefit, the ancillary benefit actually goes down. So like if they would have done it this year to like, would we see much more depleted dental for 26? Would we see much more depleted OTC benefits? Like, would some of those benefits even been gone for 2026? I'm curious because anytime you increase that utilization, it goes away. So if they also delay it for 26 and then officially remove that requirement for 27, we may never know. But I was really curious to see how notifying beneficiaries of those benefits mid-year would have actually changed the design of the plan as we go from year to year.
Well, the other thing I would have been curious on, and I know not everybody does it, but I do think there are folks that say bounce around mid-year. They'll go to one plan, utilize their dental benefit, utilize their hearing or something. Oh, I've depleted that. I've got an SEP for any given reason. I'm going to jump ship mid-year. So my thought was knowing that they've fully utilized a bunch of their benefits, how much of an incentive does that create for folks to start bouncing to a different plan in the middle of the year?
Yeah, that would have been. I mean, you would have had to track that, and almost eventually would have led to tracking and then making a database like Part D. We're like, well, we know that you've had this much dental benefit. You don't have access to this new one. That would have been interesting.
So I know the last one that you kind of talked about is the one that you got the most excited about. Tell us what CMS's thoughts are, kind of where you're thinking their mindset is on some of these RFIs pertaining to what a TPM actually is.
There is there is a lot of focus on TPMO. So we have changes to the disclaimer, we have changes to ship, we have changes to when you need to say it. One of the things that they've sent out numerous supplemental requests for information. So the first one that they list is they want to modify the current definition of third-party marketing organization to, and I quote, I'm reading this directly from the thing, to delineate the roles of and requirements applicable to the different kinds of TPMOs. So they know, and this has a lot to do with conversations that are happening with the Senate Finance Committee, with the House Ways and Means Committee, with the oversight committees that are happening from NABIP and lobbying groups and different things like that. CMS is well aware. So with this new CMS, with Oz and everyone that's in there, CMS is well aware that TPMO means something different to the actual stakeholders in this industry. And what they're looking for is they're looking for feedback. They're officially, so we've been giving it to them unofficially. We've been giving it to them almost unwarranted, and we don't want to hear about this, but we've been bringing it up to them. Now they're officially coming out and saying, well, what do you mean not every third-party marketing organization is the same? So now they're coming out, they're asking specifically for feedback from industry stakeholders, backed up by data, not just thoughts and feelings, to what these different roles or different parts of a third-party marketing organization could possibly be. So right now, the broad definition of third-party marketing organization is anybody who helps or assists in the marketing, selling, or administration of Medicare Advantage or prescription drug plan. That's FMOs, that's agents, that's agencies, that's lead aggregators, that's CRM systems specifically designed, that's mail. Like literally everyone's a third-party market. That's call
It's our
centers.
online enrollment platforms that we provide data to give to the carrier. It's everybody in the enrollment process.
Everyone. Yep. So we're all third-party marketing organizations. And that's why we have the TPMO disclaimer. That's why we have the call recording requirements. The call recording requirements weren't put on agents and brokers. The call recording requirement was put on third-party marketing organization. The TPMO disclaimer wasn't put on agents and brokers. It was put on third-party marketing organizations. So there's been a big push ever since TPMO. The idea of a TPMO came out in the final rule a couple years ago. That, listen, we're not a third-party marketing organization. We already have another acronym that we have a ton of compliance around, and it directs a ton of how we do business in the marketplace. We are an FDI. We're a first-tier downstream related entity of an insurance carrier. So we're not a third-party marketing organization. We're a first-tier downstream related entity. We work on behalf of the insurance carriers to offer their plans to beneficiaries, and we have a whole slew of compliance and stuff that we have to follow because of those FDR requirements. Every May, everybody that's contracted with JSA that's watching this podcast, every May we are going to send you an email because we're required to send you an email asking you, do you have any people that work in your office that aren't licensed, because you need to give them special training, because we are first tier downstream and related entities. So there's even special training that we have to do as employees of JSA, and the employees of the agencies that we partner with, they have to go through it. We're already regulated that way. So when they came up with this idea of third-party marketing organization and just threw everybody into the same thing, they were trying to go after those big lead aggregators and those giant high-pressure call centers. That's who they were trying to target, but they didn't. They put all of these things and all of these new rules and regulations on the entire system. And it caused a headache. It continues to cause a headache. Now, CMS is officially putting out a request for information on who the heck is a TPMO and who should we actually be monitoring. So you could tell my passion behind this. I'm very passionate about this topic because I had calls with the CMS administrators when the call recording requirement came out in 23. And they asked me specifically, it was me and another owner of an FMO on this call with CMS. And they go, well, how many of your agents can record phone calls today? And we flat out told them none. And they're like, what do you mean? This is a requirement. Like, that is a requirement for call centers. That is not a requirement for agents and brokers. And they're like, they're the same. Me personally, have been battling this ever since they passed those rules. So I'm a big believer that this is a step in the right direction. And I almost saw this coming. It was the last was it the 20? I think it was the 24 final rule or 25 final rule. They were going to ban data sharing between TPMOs. So they were going to ban data sharing. So out of the 26 regulations or 22 regulations that were proposed for that year, I think it was for 25. Of the 22 regulations that were proposed, 21 of them were passed. That one was the only one that didn't pass, that didn't actually go into effect. So that was the first indicator that they're like, okay, maybe this TPMO thing is getting out of hand. This is the next indicator that they're seriously considering to change the definition of TPMOs and to actually figure out, how do we as independent agents and agencies, how are we different than a call center? How are we different from a lead aggregator? How are we different from a true third-party marketing organization? So that, and how should we be handled differently? And I think this is a huge opportunity for the industry. I know that NABIP is coming up. They're going to do something about it. I know we're going to be submitting a comment specifically about that. But I think that out of all of the cool stuff that we saw, I think this could be the biggest change that we see as a result of the 2027 proposed rule, is this simple request for information.
And I think what's cool about it is it doesn't necessarily represent a change that's immediately happening, or they're not necessarily going to make some sort of change that immediately takes place in 2027. But to me, it's a reflection of kind of a changing tide for us as independent brokers and the independent agent as a whole. It's CMS acknowledging that they didn't know what they didn't know when they dumped all these TPMO requirements on independent brokers. And at the same time, it's an acknowledgement of the value that the independent broker brings to the relationship with their members and in the service that they provide. And I know it's, again, these are all 2027 drafts. Nothing takes a place. None of these changes take place in 2026. But the general takeaway I had from going through the 400 and some pages and full transparency, I skimmed. I read through it. I didn't read through nearly as deeply as Mr. Hagerstrom here. But I will tell you that I came away from that feeling a little bit better about our place in the industry as independent agents.
Yes.
It's not an overnight change, but to me, it was clear that the mindset at CMS has changed from one that was adversarial and almost seeing like it was us against them to now, okay, we realize that agents are actually doing the right thing for clients. They're providing value, and we need to remove some of the barriers that keep them from actually helping the populations that they serve.
Absolutely. And I echo the sentiment that CMS is on our side more than ever. I think it was, we talked about this shortly, not that long ago, the removal of the SHIP from the TPMO. So they internally looked at the state health insurance assistance programs. They looked at those and they're like, we can't be sending Medicare beneficiaries there. Like, we can't be telling agents to send Medicare beneficiaries there. So that was number one. Number two is this is literally, I'm on page 9 of the 465 documents. And that's where they're talking about this request for information, specifically looking at TPMOs, because they know that if you're going to handle an 80 million plus strong group of Medicare beneficiaries, you can't do it through federal oversight. You can't do it through federal employees. You can't do it with all this red tape. So they talk a lot about deregulation and removing steps and getting rid of redundancies. And I think this is part of it. I think this is part of them like understanding that no, we're not all third-party marketing organizations. I mean, we're already FDRs. Like we already have compliance that monitors us, and there's pretty severe things that happen if we screw that up. So we're good. Like leave us out of it. All the other people that are causing the issues that are calling the increase in the complaints to Medicare, although they're proportionate to the growth of Medicare beneficiaries. But they like to use it as the reason why they put all these new requirements on us. Like, well, we have all this huge growth in CTMs. Well, you're having huge growth in Medicare. It's going to happen. But I think this is a huge step in the right direction. So if you support any of the proposals, or if you don't support these proposals, I didn't tell you about everything because all the other stuff that's in there really doesn't pertain to us as agents and brokers. But if you support those, you could submit comments directly on their website all the way up until January 26th. So we'll be submitting comments, but I'm going to give you some advice. And we've done this in the past. Don't yell at them. Don't belittle them. Don't demean them. CMS is looking out for Medicare beneficiaries. If you are going to support something, you give them facts, if you can, evidence on why you support those things. If you don't support those things, you give them facts and evidence on why you don't support those. And they got the final rule for 25, which had all those big scary commission changes in it. They got 1,047 comments in a 60-day window on a piece of rulemaking that generally goes largely unnoticed. So they got 1,000 comments, and most of them were thoughts and feelings. Like, this is how I feel, this is what I think, this is how I feel, this is what I think. They don't read those. They even, when the final rule came out, they even said we didn't even address half of the comments that we got. They specifically said that. So if you're going to send a comment, I think as of this morning, there was only 4 publicly posted comments. So there's not been a lot of comments on this right now. But once again, we're at the end of AEP and we have till January 26th. If you're going to leave a comment, facts, supporting evidence, what does your expertise tell you on why this is a benefit to the system if you want to support these changes? Because even though they propose them, if they're going to look at support and people that disapprove. If there's only disapproval on something and very little support, they're going to disapprove something. So if nobody comments on the elimination of the 48-hour scope of appointment form, but some people are like, well, then call centers are going to be able to get in touch with people and enroll and replace my book of business and blah, blah, blah. If all they're getting are negative comments about that, then we're going to keep the 48-hour scope of appointment rule. So we encourage you guys to at least leave a comment or be mad at them and yell at them about something that they're not doing right. But be constructive in your comments. And even if you have one you want to submit, and if you want me to look at it, I'll gladly look at it and review it for you before you
I
submit
think, Chris, you kind of touched on something, but it's a really important thing to remember. As you're putting the comment together, or as you're considering feedback on this, Chris, you hit the nail on the head. Remember that CMS's goal is to make sure that the member or the beneficiaries are taken care of. They're not out there to make things harder for us. They're not out there to make things easier for us. We are a tool for them to make sure that that end goal is achieved and that the member is taken care of. So have that in mind as you're putting any comments together. That gets a lot more traction with them, other than saying, hey, this scope of appointment thing going away, that's great. It makes my job as an agent easier. So that's going to get less attention than pointing out how it makes it easier for you to do your job, which is to help beneficiaries get the right coverage for them.
Absolutely. Absolutely. I'm hoping we see all the things we talked about today implemented. I don't see I remember last year, my God, 24. I remember going up in front of groups and crowds of people and telling them all the scary stuff and what could potentially happen. And this year I get to spread good news, so I'm pretty excited. So I hope a majority of this stuff passes. But if you're trying to figure out a way, if you don't want to leave a comment, maybe you're not a great wordsmith, you could ask ChatGPT to write it. It does an okay job. But it's if you're looking for a way to support these kind of things, or there's a reason they're looking at what the definition of a TPMO is, and that's because of a lot of lobbying efforts. So if you have the ability to talk to your local congressman, your local, whether it be a senator or your rep, if you have the ability to join like NAFA or NABIP or any of the other groups that are out there that are actually lobbying these folks, I recommend doing it. It's well worth your dollar to be able to have those conversations and get people in position working for you and being an advocate. We've always been an advocate. We're continuing to be an advocate for our agents when it comes to things like this. That's why we watch it like a hawk. And Henry and I are kind of policy nerds. So every time something comes out, we're always messaging each other. Hey, did you see this? Hey, did you see this? So we'll continue to be fighting for you guys as well, because it's a lot of these. CMS only gets an opportunity to change the Medicare program once a year, and this is how they do it. So always look out for the proposed rule. Submit a comment if you can, or support those that do. And then usually beginning of April is when the final rule comes out. So for 24 and 25, it came out April 4th. So usually right at the beginning of April of the following year, so April of 26, we should have the final rule out. And hopefully we see a lot of these positive changes for 2027, because Lord knows this next AEP, this last AEP was nuts. This AEP is nuts. Next AEP is going to be a level of nuts that we've seen. It would be nice to be working through that AEP, having some really great news on the ability to help more Medicare beneficiaries in
Exactly.
2027. You got any final thoughts on all this that's going on?
The only thing I have, and I feel like I'd be remiss if I didn't say it. I want to speak on behalf of the other three sales VPs here at Jack Schrader and Associates. If you're one of our agents and you're seeing this before the end of AEP or shortly thereafter, I know it's been a heck of a ride. I want to thank you for your time, your effort, your energy, doing everything you've done to make sure you help your clients this year. We thank you for the business. We thank you for the partnership, and Chris, I know you've been extraordinarily busy as we wind AEP down as well. I want to thank you for taking some time out of your day to kind of go over this and dig into this a bit more than maybe just a 1 or 2 page snapshot. So again, I'm
No, rest assured, I'm running to Facebook to go make my little pink background post. You don't worry about that, Henry. I got it.
love it. Well, again, thank you everybody. Uh, if it's not the end of AEP yet, by the time you see this, finish strong, and we appreciate you.
Yep, let's knock out of the park, everyone. Thanks, Henry, for joining me, and we'll see you guys on our next episode.
Take care.